Good afternoon, everyone, and you're very welcome to, this is our 19th episode of QPS TalkTime. I'm just going to run through a couple of notices while we wait for people to log in, and then I'll introduce you to our panel. So today's session is about patient safety together, and I'm just going to share with you some of our QPS resources. So the document there, the Irish Human Factors in Irish Healthcare 2018 to 2023. That's an evaluation just of research and publications related to human factors in Irish healthcare. So do check that out. The prospectus again for quality and patient safety education and learning, and that's updated now for the prospectus for 2024. So I think you'll find lots of resources there if you're interested in this. Just to flag up our podcast series, and we have a new podcast with Helen Bevan, so I certainly would encourage people to check out that. And there are, I think, several other episodes. I think this is possibly the 8th podcast on the series. So well worth checking out that new podcast with Helen Bevan. And then finally, really just to flag up for people, if you haven't been involved before in the Q Exchange program, the submission for ideas is open, and that has to be completed by February 27th. Now, I think getting your idea in there is the first step. I think there will be time for fleshing that out, but I think in the first place, I would encourage people to check this out and get your ideas in by February 27th. There is up to £40,000 worth of funding available for QI ideas. So if that's something you're interested in, please check it out. We have had several successful projects from Ireland in the past, so we have a good track record there. And as always, do follow us on social media. We're on Twitter, X. We have a YouTube channel where you can find previous episodes of the QPS Talk Times, and also LinkedIn. You'll find us there too at HSE National QPS Directorate. Now, the objectives of today's session, we're going to really take a deep dive into the work of Patient Safety Together, which is a new platform within the HSE, and we're going to learn about what they've been doing there, and we're going to hear all about it from the panel. Explain how learning is identified, developed, approved, and shared through Patient Safety Together. Going to share the impact on patient safety through reporting incidents, sharing learning, and engaging with Patient Safety Together. And then the panel will obviously, after telling us about Patient Safety Together, we're going to have some panel discussion, and we'll be able to explore some queries, gather feedback on your experience of the Patient Safety Together platform. So it gives me great pleasure to introduce our panel today. So we have Lorraine Schwanberg, Assistant National Director for Incident Management, Alan O'Gorman, Director of Nursing at Croom Orthopaedic Hospital, Dr. Darren McLoughlin, Consultant in Emergency Medicine and Chair of the National Patient Safety Alert Committee, and Darren's based, I think, in the Mercy in Cork. Catherine Hogan, Patient Safety Together Lead, and it's a real pleasure to welcome our old friend on QPS TalkTime, Tiberius Pereira, who is member of Patients for Patient Safety Ireland, and Noemi Palikos, who is Patient Safety Together Coordinator. So everyone, you're very welcome. We've got lots to get through. So I'm going to maybe hand over to Catherine at this stage, who I think is really going to set the scene for us and tell us all what Patient Safety Together is and what you've been doing. So Catherine, over to you.
Thanks, John, and good afternoon, everybody. So I suppose to start off, I'm going to just present a few slides that will either introduce you to Patient Safety Together or else serve as a recap to those who are already familiar with what we do. So Patient Safety Together is a programme of work within the HSE that uses up-to-date quality patient safety information, including incident management data, international evidence, referrals and feedback, to learn from incidents, research and data, to learn directly from patients, service users and staff, and also then to signpost to QPS academic papers, resources, conferences, etc. And we share this learning through a number of outputs. So firstly, through HSE National Patient Safety Alerts, and these require services to take specific actions within an identified time frame in order to reduce the risk of incidents that have the potential to cause serious harm or death. And these are issued through both a QPS alert system, and they're also freely available on our webpage. And in 2023, there were 5 HSE National Patient Safety Alerts issued, and the most recent one being relating to sepsis in children and young people. And then following a suggestion from one of our patient advocates, which was Tibbs, who is joining us today, we co-developed a new infographic, and that was what does it mean for me as a patient or service user? And that is now issued with all alerts. And this uses plain English to explain what an alert is, why it's being issued, and what the alert means for the patient, service user, or their family, and what, if anything, they may need to do if an alert is relevant to their care. So we also publish patient safety supplements, and these are short publications to raise awareness of a clinical risk or patient safety issue. And in 2023, we issued 4, including recognising and supporting adult safeguarding and recognising surgical site infection at home. The Spotlight series then highlights different initiatives where there are examples of local shared learning or patient safety content that may impact the wider healthcare audience in Ireland. We issued 2 in 2023 and 2 so far in 2024. An example include the Patient for Patient Safety Ireland's call for National Health Literacy Initiative, and also kind of signposting to HICWA's Learning Hub. We also co-develop a HSE Patient Safety Digest with our own HSE Library Services and the Health Products Regulatory Authority, and that contains listings of recently published articles, reports and information relating to patient safety, and HPRA approved communications containing important new medicine safety information, and digests are published quarterly. So learning then directly from patient users and staff, we have patient safety stories, and this gives voice to the experience of both patients, service users and staff who have either been involved in or impacted by patient safety issues. Currently, we have 12 stories available in both narrative and video format, and we have a new video story now in production also. And then we have our patient safety community. So this is a national community for HSE and HSE funded staff with an interest in quality and patient safety. So the community offers peer support and opportunities to share learning, to network and to work together through both virtual and in-person events, and also through the online forum via the Q's community platform. So everyone who uses and works in our health service has an important role in the success of Patient Safety Together, and the membership who actively contribute to identifying and developing content is wide, and it includes patient and server user representatives and both clinical and non-clinical members. And this slide just shows the multidisciplinary membership of the HSE National Patient Safety Alerts Committee, and the picture there was just from the launch last year. So along with everybody that contributes regularly, we also collaborate with different subject matter experts for each specific publication. For example, you can see from the slide here, in the development of the alerts last year, we worked alongside, for example, the Pew's Interim Governance Group, the National Reeling Office, the Emergency Medicine Programme, the Irish Medication Safety Network, the College of Anaesthetists of Ireland, just to name but a few. And similarly then with the patient safety supplements, we collaborated with the Tobacco Free Ireland programme, the National Safeguarding Office, National Improvement Programme in Wound Management, and HSE and Community Operations, but also importantly with patient advocate groups, including Patients for Patient Safety Ireland alone and the National Advocacy Service. So 1 year on, we've established the team, the committee, the community and the website, and numbers continue to grow of active users who use patient safety regularly to see what's new, to download information and to play their part in sharing patient safety learning. So it's great to see the numbers, and hopefully we'll continue to grow that as in the months and years ahead. Thanks, John.
Thanks, Catherine. That's fantastic. I mean, we need to remind ourselves that it's really only a year that Patient Safety Together is in operation, and I don't think any of us doubt the work that's needed and the urgency of doing this. But I think it's fair to say you've accomplished a great deal in that year. Darren, can I ask you, Darren, why is this important? Why do we need to learn and share this learning?
Yeah, John, it's a brilliant question, isn't it? Because the way, just in my opinion, I think that it's a really complex interaction between the patient or the person and the healthcare provider, and I think there's a lot of knowledge that comes, and like despite the best will in the world, patient safety issues arise all the time, and if you don't see them, you're not looking for them, so we have to be vigilant about those. That even what might appear to be a very straightforward pathway or protocol, somebody coming in for having a blood test or something, mistakes can happen. It's very easy along the process, whether it's technical or non-technical, in the human factors arena, the more we learn about that. So we need to, and there's a lot of knowledge that comes from those interactions, but then we need to share that. And we need to support everybody learning about things that happen in other interactions. So I don't know if does that make sense? That if we're, so, and we're part of, as we're saying, we're a piece of the puzzle. We're trying to support the patient and the healthcare worker, to manage those complex interactions and to reduce the risk of serious harm in that area. Yeah.
Yeah, fantastic. Thank you. And Tibbs, Patients for Patient Safety Ireland here has been a critical partner in this as well. Why is it important, the patient point of view?
Well, it's patient safety together, together with National Patient Safety Alerts, the Spotlight series, the patient safety supplements, and so on, has been, is a great way to get information out, not just to healthcare professionals, but also to make it available to patients as well. And it's all part of empowering people so they can be active partners in their care. So that's been a really important thing for us. As you may know, about a month ago, we launched our patient safety, our health literacy initiative, with the aim of empowering people to be active partners and advocates for their own care. So having these, in particular, the "what does it mean for me" summaries with infographics, following the HSE's communicating clearly guidelines and so on, does empower people kind of with plain English to actually understand things a little bit more and to play that role of being active partners.
Great, and I might just even bring Darren back in there again with you, Darren, in terms of working with the group and with Tibbs, I mean, what have you learned over the year working together on this?
Yeah, I think that the more we talk with patients and patients themselves, they come back, and if they're able to identify things from their perspective is really important. And that's why having patient representatives and patient advocates, they see things differently from us. Like, say I happen to work in a hospital, or a general practitioner will work in their practice. They're seeing things very much from their side, or a nurse is seeing things from their side, where we need to see it from the patient. We learn more about the entirety of the picture of the interactions and where things can go wrong and where can we improve and how we can make it safer. Yeah. So I've learned from, like, even from Tibbs, I think, even on the communication side of things, I think that's really important. And that's kind of our business in patient safety together, is improving that two-way communication, that dialogue, and making the healthcare literacy piece that makes it more relevant. And then the patient is then empowered. If we get the communication right, then our patients, the people, are empowered to ask that question. Have you taught of sepsis? Have you washed your hands? Simple questions that kind of are the trigger for the healthcare provider, just to make sure that the high priority issues are there, and we're having a similar conversation.
Great, thanks. And even just looking at Catherine's slides there about the number of people who are engaged with some of those safety alerts, it's a very wide partnership, isn't it?
It's impressive, and you can kind of see that, like, it's not just a singular kind of one-to-one a dictatory kind of message. It's actually, and then when you see the amount of people involved in looking at the information, the people who we're going out to, that other slide that Catherine has of the expertise that we're drawing on to support everybody, in their interactions. It really is. Yeah, it's a phenomenal amount of work, and I think that's where we get. That's where the money is, John. I think it's the interactions and making those networks happen. Making everything come together.
Yeah, great. Thank you. And Lorraine, I might ask you, how does Patient Safety Together identify, the safety issues that it's going to focus on and work on?
Thank you, John. So there's a few things that we're doing at the moment in terms of identifying what kind of safety issues we might focus on. So we have the privilege, I suppose, within our very small national team to have access to the full spectrum of incident data, which is we have, it's anonymized to us. We don't see identifiers in that, but we take that responsibility very serious. So we do monitor incidents or any recently reported serious harm incidents to see if what particular trends are emerging. And we certainly have picked up on a couple of trends with regards to that are happening across the national setting, and we'd focus our kind of safety messaging around that, because as you can imagine, when an incident might happen in one setting, there's high potential that might happen elsewhere, and it's really important that we look at the system learning with regards to them. We have some other sources that we look at more closely. So again, we in the National Office have access to coroner's recommendations that are being received. So that's a new group that was set up in the summer of last year. So we've interacted with the coroner's group to ask them to send learning and recommendations to us so that we have insight into that as well. And we do, I say the royal we, but it's all down to Catherine and Naomi. They do a phenomenal amount of work and do that kind of horizon scanning. So we see if there's any safety critical messages that are being published elsewhere in the UK or even further abroad. South Korea have quite a nice website and things like that. So we do a lot of horizon scanning. We bring it back to the NPSA committee and we consider some of those issues that are being raised. And then importantly, we also ask colleagues out in the system to contact us with any kind of suggestions or maybe any local learning. So one of the safety supplements we're hopefully working on was specifically around learning from one of the reviews that an organization undertook. So again, we'd like to encourage you, if there's any particular topics for us to hone in on, we'd really welcome that.
Great. Yeah. So a very wide scanning kind of all these different places that ideas for improving safety might be. What happens? I might go back to Darren again. What happens then when something is identified and it's decided that it's going to be brought forward to the committee, Darren?
Yeah, so John, we're constantly monitoring this horizon scanning. We also accept referrals in from groups that have found, are looking at coroner's recommendations. So we bring that to the Patient Safety Together team, and then we bring that to our committee, and it's a wide committee with a very broad membership in different areas with different expertise and different situations. So we identify the issues, we analyze the information, we look for where the learning is and what we can share. So then we also have to look at threshold. Threshold is very important, because what's the word? Like we don't want to overburden people, and it'll drown out if we send too many patient safety alerts. So we want to have kind of two streams. So to rate it, how important is this? So we provide information that people can opt in. That's the majority of the information that we'll be gathering and providing. But then there is some very high priority information that relates to patient safety or patient harm that we've identified that needs to get out there, and we'll send that as a patient safety alert. So we then have a design thinking approach and to identify those problems, but we also want to identify solutions. So we're not burdening everybody with a problem. We want to identify the risk so everybody's aware of it, but we also want to provide a structured solution that we've thought about. We've kind of road tested it with our colleagues and to see if that's fit for purpose. So then when we send out this information or this alert, well, then it will land in the right area to the right people, and they will have a plan of what they can bring this, and they say, okay, we need like a checklist. Then they can have the checklist. Have we done this, and then they can turn around and say, yes, we've done that. We've closed it out. We have alerted everybody to the issue, and we have these safety countermeasures or mitigations in place.
Right. And Darren, you've done a number of these at this stage. How long does it take to do one of these? Or because there's a time critical nature of this as well, isn't there?
Yeah, isn't there? So most kind of patient safety incidents or issues, you kind of have to investigate them. You have to identify the issues. There's a lot of time until this becomes alert. And I suppose Rob and CHI there in the chat mentioned that that's the issue with some of our issues in patient safety, that they're separated by time and space. So the shorter we can bring that together, it could take months to get everybody together, prepare a patient safety supplement. But we convene, as you know, John, we've called on you before, convene at very short notice on a Friday afternoon. We convene our committee together. We convened other committees with expertise to feed into our committee, so then we can bring the solutions together and the actual issues that we want to highlight. So it can take weeks or months to prepare a patient safety supplement or other information, or a month, but we can develop this over a few days as needed, because we need to have the right people there.
Yeah, great. Thanks, Darren. And Catherine, what happens then when the committee has done its work and the alert is prepared? What happens to that alert then?
So I suppose all our publications are freely available to access and download on the website, and the way is going to take us through how to access and locate these different resources in a few minutes. But additionally, the alerts then are also issued through a QPS e-alert system and with a closeout date for action where applicable. So every hospital and community service in the HSE has a dedicated alert officer and supporting coordinator to both receive and coordinate and management of the issued alert locally. The e-alert system itself, it's a closed loop system whereby when the alert is issued, we can get assurance that it's been received and actioned by all areas by monitoring when the alert has been both accessed and closed out by everybody that's set up in the system. And then we also link in with officers and coordinators to provide training and support and help troubleshoot with individual issues. Up to now, all alerts are also issued simultaneously via the operational line through the Office of the Chief Clinical Officer. However, as the e-alert system becomes more embedded and access issues have been resolved, the option of the operational route for dissemination will be reassessed as we're going on. And some areas that haven't been set up in the e-alert system will be sent the alerts directly for information, including HICWA, the Department of Health, the Private Hospital Association, some Section 38s and 39s that can't get around our firewall. We can link in and send them directly. And all publications then are supported by a social media campaign on X and LinkedIn, and also then via direct messaging to some groups. So we think we have all bases covered, John, but I'm sure there's other places we could. Sometimes maybe the default is we're sending it out too many ways, so people are receiving it more than once, but we'll hopefully perfect that as we're going on as well.
Yeah, and I suppose you've had the chance to learn already from some of the alerts that have gone out, and
For sure,
yeah. And so maybe just to go on this journey with the alert, so the alert leaves the system with Catherine, and then it goes out. And Alan, I'm going to ask you what happens when an alert arrives locally. How is that managed?
Yeah, so we get the alert obviously through the system, the alert system, and at first, I suppose when we first got them, we changed this kind of process. It is sent to each site done. So I'm in the UL Hospitals group, and we've 6 sites, or to the head of service. And at the start, we were nearly doing our own thing and trying to answer it ourselves and apply it locally. But we found very quickly through the pediatric early warning score that if we actually got together and had a call between the officers and the coordinator, it made things a lot easier. Because we were responding individually to the system, and the QIPs or the responses were different, and we were all saying different things, and we were answering the same question as such. So we kind of quickly realized that a quick call, Teams call, kind of solved an awful lot of the work, and it also helped us to kind of target who we needed to talk to about the different alerts. And like the alerts are great because it gives you that initial who you should talk to, or who we think, but each area is different and each service is different, so it may be slight change of plan. And it also provides assurance, I suppose, that you are doing the right thing, and to the organization, you know, as a whole, that something is being tackled or is being addressed. So our director of QPS is our coordinator. So at least in her position, she can kind of go back and say, look, this is in hand in all the sites, or there's a problem, or this is what we need to do. And I suppose just in response to one of the comments in the chat there, it's like, how do you get it to the people in the front line? And that's always the most difficult. And we've seen, you know, we've seen the difficulty in dissemination of information, I suppose, on my site, trying to get this stuff out. So again, we target the who exactly we should be talking to from the alerts, and then to our own discussions, who exactly needs to be officially alerted. But then for general information, the frontline staff need to know that, you know, they may see it through the social media, and how we address that. So I, on this site and many others on different sites, you know, tackle it probably slightly differently, but, you know, we discuss it. We basically bring it up at meetings. So our site ops meeting, we would discuss it. Our clinical nurse manager meetings, we discuss it. Team meetings, it would be discussed. And then the posters and the alerts themselves, if any of you, I'm sure you've all seen them, they're very printable, and they're very, you know, notice. You know, put them up in a notice board, they catch the eye, and they do gather questions. We do have people looking at them, and then, you know, backing on to then what like Tibbs was talking about the patients being notified and the patients being involved in care. We're very lucky that we have a patient council in the UL Hospitals group, a very active patient council, and I'm very lucky that I have a very active local rep, Bernie, who's just a powerhouse of willpower, I suppose, to get things over the line, you know. So we bring it up there at our patient experience committees, which we have kind of every 2 months, or if there's an issue we may ring. And I suppose that's really on the back of on the social media. So everything we release is freely available at social media. So for example, you know, we had the CE markings at the beginning of the year. We're a mainly elective surgery site, and the surgical site infections. So our patients see this, you know, our patients are getting younger, more tech savvy. So the infographics that Tibbs and the team have worked on are really good, and we need to now work on that a little bit better, on how we display that more than just kind of having it on notice boards, and kind of involving our patients a bit. So that's, you know, that's probably the next step, and we've got kind of the system and the staff, you know, kind of sorted. It's moving on now to make sure we fully engage with the patients, you know.
Fantastic. And you know, Alan, it sounds really like this has helped to create local communities, you know, of safety, or interest in safety, that again draw on a broad, you know, patients, practitioners, you know.
Yeah, and I think sometimes, you know, you'll always have a community, or you'll always have people willing. Some people need to be kind of pushed into something, you know, and to bring it in, you know, and sometimes a little bit of a strong arm into this stuff, and these discussions, and be notified about things will help, you know. And ultimately, we're here for the patients. So, you know, once they're being properly looked after and safely being looked after, then we can all, you know, move about business.
Great. Lorraine, Alan mentioned there, you know, the importance of assurance, you know, in this, and what's your sense that this is having an impact and helping?
Yeah, it was very encouraging to listen to Alan there, wasn't it? That was really the vision. I mean, we can look at the data and develop resources and that, but we do want it to get to the front line. That's really our measure of success. So look, it's relatively new, as you mentioned. We're in operation a year. You can see all the people that are involved and supportive. So there is willingness there, and I think the messaging has been welcome. So it's important for us to stay relevant. We have an evaluation strategy, which is due now. I think that's one of our next pieces, to see where we can make improvements around the information and that. We do want to link in with local sites to understand how is it working. We want the material to be accessible. We have the Google Analytics data, so we know that people are actively going into it and that. But at the end of the day, we want to make sure that it is having an impact on patient safety, which I know, as you mentioned, is a difficult space to measure. But there are certain topics that we're obviously honing in, and we want to see that patient safety together as a piece of the puzzle is making an impact in those areas as well, and that we improve patient safety through the comms, the wider system engagement and that.
Great. Thanks, Lorraine. I think it might be helpful at this stage, maybe, if we had a look at some of the resources and outputs. And Noemi, you were going to share with us just some of the resources that are there, and maybe look at the website and various bits if that was possible.
Yes, John, thanks very much. And hello, everyone. I'm just going to briefly show you how to access all those fantastic resources. And Juanita is going to pop up the link to the website in the chat. So I'll invite you to, if you want to navigate it with me while I'm talking, instead of looking at the slides. So the link will bring you to this landing page. And if you click read more below the title, that will bring you to all the detailed information about patient safety together. For example, the purpose, how it was developed, and some resources like the evaluation and referral form. If you click, please, Juanita. That's it. Yeah, thanks. If you click again, please. The same if you click about read more about the alerts, you would see there's an information video and an introductory video. There's more local resources. And the same with the supplements. There's a description and then there's a listing of all the supplements. Next slide, please. Okay, if you look at the second part of the landing page, you have patient safety stories. Again, the about page will show you detailed information of the description. Yeah, thanks, Juanita. The description of what's available in there, relevant resources, and a listing of all the stories available. And the same with the further learning. And if you click on an individual link, you will have, for example, the Spotlight series with a hyperlink to access the actual document and download it and bring to your meetings or boards or whatever you want to do. And the same with the digest. And to let you know that this section is being upgraded as we speak, so it'll be brand new soon, because the amount of resources we're getting has exceeded the original site space. And also at the bottom of the page, there's a quick link to join our patient safety community that Catherine mentioned before. Next slide, please. Now, if you, in the landing page, you could see there's all the, for example, patient safety alerts available. So if you click on the link, like the latest one, the sepsis in children and young people, you will see a website description of the alert. And you have a download option to download the alert in PDF. Please, Juanita, click. And the back, yeah, what does it mean? Back, one back, please. Yeah, the infographic as well, supporting the alert, and also any relevant supplementary information or the additional action plan, which is per feedback, very helpful locally. So next slide, please. And just out of the oven today really is a new brochure, which will be launching soon, and is basically patient safety together, who we are, what we do, how to connect with us. And it'll be available on the website soon. And you could bring it to your meetings, patient safety days, and we think it will be very helpful to show everyone what patient safety together is. So thank you very much.
Great to see the resources, and I think we'd certainly encourage everybody today, if they've not already checked out the website, to do that and kind of become familiar with it and find all the resources that are on it. So well done, everyone. You know, you've, like we said, you've only been doing this for a year, and I think you've already accomplished a lot. But what's going to make it an even bigger success, and really the things that you might want to do in the next year or so for year two, Darren?
Yeah, like John, that really is where we want to be in this area, where there's a call to action on all of us, to improve, because I think when we're dealing with in the business of healthcare, you know, our patients are very vulnerable. You know, I don't know if you've ever been a patient, you've come into hospital and you're lying on in a chair, you're sitting in a chair or lying on a trolley. You know, you're very vulnerable, and all of a sudden things are somewhat out of your control. So I think we need to be very mindful of that. And our healthcare providers that we work with, we're vulnerable as well, because things don't always go as planned. So if we have this kind of disposition of humility, and we're kind of ready to learn, if we're humble enough to learn, and we're curious to find out how we can get better, I think that's how do we do that? We need everybody in on this conversation. Everybody who's working, you know, it's difficult because people are busy, and you know they're trying, everybody's doing their best. That's why they're coming into work, and they have on one reason they want to deliver this service, this provision of care, but they also want to improve. So I think that's where we need to catch people. If people can come to us and engage in that conversation, I think that's where we want to be. That's where how we all can improve. Yeah.
Great. Lorraine or Tibbs, anybody else have any you know, things that they'd like to see happen over the next year? And I'm sure you all, you know, agree with Darren's sentiment there.
Yeah, I fully agree with Darren. Actually, I don't know if I wrote that script, Darren, but it was you know, fully agree with that. And you know, I do say I would acknowledge that the Patient Safety Together team has always been committed to clear communications, and you know, the whole idea of empowering people. But yeah, you know, when people are sick, they will feel they may well feel vulnerable. So. You know, I think we know from a lot of research in Ireland and around the world that people who are better informed about their health have more effective consultations, can be better informed about things like medication safety, which, you know, and overall it reduces the burden of the health service, and overall does produce better health outcomes. So, you know, it's great to see this engagement, this level of engagement from the team on continuously, you know, developing, you know, the way that the communications going out, and seeing patients as partners in care.
Thanks, Tibbs. And Tibbs, have you had any feedback on things like the patient safety? You know, what does this mean for me, for, you know, the patient perspective in the alerts? Have you had feedback from patients, patient safety members, or from the public?
Well, I mean, it's mainly from other members of Patients for Patient Safety Ireland. You know, the feedback has been really positive, and it's one of the things that we're then applying as templates, and we've built into our you know, health literacy initiative as well. So together with you know, all the big advocacy groups and a number of smaller ones as well, you know, we're all starting to ask for the same thing. So, you know, Patient Safety Together has kind of led the way in that, has been well ahead of the curve, because we only launched our initiative a month ago. So, you know, it's really useful to be able to point to an example of you know, where things are being practiced in this way.
Super, thanks. And Lorraine, where do you see this going, and what are your ambitions and hopes for the next year?
We have lots of ambitions around it, but I think, like Darren said, the call to action really, you know, for colleagues to think about how they're bringing some of the resources to the front line, be it team meetings, safety huddles, whatever you have set up in your organizations. And for us, we want to make sure that the information or the areas that we focus on remain relevant for everybody out in the system. So again, you know, to link in with us to flag any kind of topics. And like there's certain pieces that we're doing, we're constantly improving the e-alert system, the actual website page and things like that. So we are responsive to the feedback, but overarchingly, I think just to kind of embed that learning culture within the HSE across the whole system, and patient safety together being a part of that puzzle, really.
Yeah. Like John, that kind of automatic kind of absolutely, Lorraine, that kind of automaticity of it, you know, that, you know, something happens, then it turns into you know, into information, the learning is then shared, people are anticipating, you know, that they're going to get more information about a critical patient safety topic, and then they're also then going, oh, when they find something in their work, they might go, they're much more attuned to spotting something and feeding that back into the system. So there's a continuous learning cycle. That's, isn't it, Jeff?
Yeah, I think this is how I think you create good cultures. I think around and things like safety, and I think this is a critical part. Like you said, this is part of the puzzle, and I have to say, well done, everyone. Juanita, have we any questions in there? I see that there's lots going on in the chat, and we'd encourage anybody, if you want to ask a question now to the panel, please pop it in there.
Absolutely. And firstly, just to say thanks very much to the panelists for their patience. We're missing a core team member today, and they've had to put up with me moving slides and doing the chat, and there's a lot of work in this, people. So just thank you very much for your patience. In terms of, I suppose, the chat function, it's slightly different. It was, that touching on that patient partnership piece, and that a lot of healthcare providers are intimidated by patients who want to be equal partners in their care. And if you're thinking of the Patient Safety Together community, obviously a core part is the patient involvement. So just, do you have any lessons from that perspective? And Tibbs, obviously, you've experienced a lot of groups at this stage. Are there things there that make it a better working relationship where patients can actually be an equal partner in this sort of stuff? And equally, Lorraine and Darren, or Alan, from your perspective, is there anything that you want to pop into the mix there?
Well, if I could say, I've been a bit of a frequent flyer in the health service in the last 6 years or so, and the care I've experienced, like the care that most people experience, has been excellent. So we're not talking about something that's a radical change. A lot of this is actually common practice anyway, and a lot of it actually follows HSE policy and guidelines. So things like make every contact count. Things like hello, my name is, the communicating clearly guidelines. They're already there, so it's nothing really new. It's about ensuring that it is practiced. Even open disclosure, it shouldn't just apply to adverse events. So it's kind of making sure that it is general practice in operations every day across a health service. I don't believe it's anything to be scared of, and there's a huge amount of research backing up the fact that being open and empowering people actually does produce much better outcomes for all involved, not just for patients.
Great, thank you for that. Darren, did you want to come in there?
Oh yeah, just like I think that just going back to that, it is interesting if people might feel intimidated by an empowered patient. I think that's where things get safer. And then if the healthcare provider doesn't know, well, then they can, like, being honest and open, you can just turn around and say, look, I don't know, but I'll ask. And then there's lots of people behind the scenes. I might know right now. You don't have to know everything right now, but it is interesting, yeah, that hesitancy that we feel from kind of maybe a more classical way of interacting in healthcare, that kind of paternalistic. If we could drop the paternalistic, drop the judgment, and just get on with our work, and then we can have a very equal relationship. And that's kind of a lot of our work would be, if you have a shared patient decision making, I think that's very beneficial as well. Yeah.
Yeah, it's interesting, and one of the things I love about the talk time is a few other people in the group have come forward with some suggestions of resources. And in particular, they mentioned there's some really good stuff around the assisted decision making and the consent policy, and using those resources in this space are really helpful. I think the other thing to think about as well is that sometimes when our role changes, there is that question, okay, well, what is my role now? So if I was the knowledge expert before, where does that leave me in that new space? And I think the safest thing to say is none of us are going to be out of the job, because there's enough work in healthcare, I think, to keep everybody going. But the dynamics will change, and the conversations around, well, what does my role look like now if a patient is coming in and they are more empowered, which is what you want, and that they're sitting there and they are an equal partner. Well, how does that change, and what conversations do we need to have as healthcare professionals to say, well, what is this new space that we're working in, and how does that affect my role? What is my role in this area? So I think there's a lot of really important stuff there. And Bernie O'Reilly just said we engage healthcare for their knowledge and advice, not to make decisions for us, but to help us make the right ones for ourselves. And Bernie is actually the chair of Patients for Patient Safety Ireland, and I think that should be probably printed on a postcard and stuck up in every notice board around the country. Bernie, I think that captures it and sums it up really well. The other thing I suppose I was struck with was Alan, and there's just a comment in on the group of the team meeting when an alert comes in that you don't have to figure this out by yourself. You know, is there a lot of work that comes into that collaborative conversation piece, or is it something that happens quite organically when something comes in now?
Yeah, no, it's very organic, and it saves a lot of time, because you know, you'd be sitting here reading something going, am I doing the right thing, or making a quick phone call to somebody, you know, to a colleague in one of the other sites or something to double check. So no, I think you know, they could take a half an hour, they could take less, they could take a little bit more, but the time they save, and I think as it's a new process, you know, and all of them are slightly different, or have been slightly different, or have involved different people, that from a group perspective, and we're all in a group of some description, you know, and we're all moving that direction, so things will change. So like having a team is easier, and like we all take our own responsibility, or we all take our own actions from it, or else we can kind of jointly say, look, we're going to need to resource this, or we're going to need to divert resources. Like the pediatric early warning score was probably a prime example, where, you know, that went down to actually having to get the printing, you know, the printers involved to see, okay, how quickly can you get these reprinted, and this input in the, you know, which actually took way longer than any of us thought. But that's actually how it started. That's how we started getting together, was around the pediatric early warning score, because of the complications of just getting the printed, you know. And it's down to these little things. Where we at the committee stage, you know, we say, well, that'll take X amount of weeks, but the printer says, are you absolutely having a joke here? Like, you know, not a hope. So it's, you know, it helps. So you're not ringing the, you know, it sounds very simple, but it's actually very important. You can't change the forms without the printer.
No, no.
You know, yeah, so that helps. It helps.
Yeah. I think one of the things that I think is coming out as well is that sort of sense of community, in terms of we're not doing these changes in isolation. And, you know, maybe Lorraine, you know, and Catherine, you might want to come in here. I suppose if a group gets together and they're saying, I don't understand this, or this isn't making sense to me, where can they go with that, or what's the best thing to do if your group is coming together and they're not sure about something that they're reading on an alert? Where should they go?
So I suppose every alert, Juanita, would have at the end of it, you know, to contact us if there was any issues. So we have our dedicated email address. It's patientsafetytogether@hsc.ie. And once, depending on the alert, once we get in a query and it has happened, then we can link back in with the experts in the area to say, this specific query has come in from such a person or such an area. Can you help advise on it? So there is a kind of an alley there for queries, for feedback, for comments, you know. And interestingly, you know, it's often, and we kind of alluded to it earlier, is that testing piece before it. We try and have kind of anticipated some of the issues that might be there. Now, we hadn't thought of the printer one, Alan, but I suppose, you know, you live and learn. So we do try and test locally, and we work with people on the front line to say, does this alert make sense to you? You know, is it implementable? Do you think it's going to make a difference? Are there any other challenges it might bring if we make these changes? But you know, you're not always going to get everything identified straight away. So back through the email then, and we can link in with the right people to figure out what the story is.
Yeah, I'm often struck by the fact that you can have an alert, but systems might be a little bit different, or locations, geography, and all that, and you can only do so much. But the alert is the minimum specification. You know, that sort of sense of, this is the minimum that we need to be doing as a group, and then how we go about doing that around the structures and the culture locally might be a little bit different in different places. But the fundamentals nationally should be the same, so that we're all moving in the same direction. I'm conscious of the time, and John, I'm going to come back over to you in a moment. There are a few people coming in just on that question around patient engagement, and in particular to say thanks to Tibbs for his insights, and just to say that there are some really good podcasts available now. So we have 2 more recent podcasts with patient partners on their involvement, and they've talked about their experience of patient engagement, the difference that it's made to them in terms of how the staff have engaged with them, what they've done that has made it successful, what might have happened that didn't make it successful, and what different levels of engagement look like within the healthcare system. So they're part of the Walk and Talk Improvement series, and it's definitely worth a listen to if you have a few other things to glean or to learn in that space. But Tibbs, is there anything that you'd like to add from a patient's perspective before we go back to John, just from your own experience, that makes a difference?
Yes, if I could just say one other thing, which is, not to see this as a separate topic, which is a separate training course. It does need to be embedded in the way, excuse me, the HSE and, and staff actually is. And if I could just say one thing, because there's one other point that was made actually about, what staff can do as well. As a patient, I'm in waiting rooms a lot. And there are some excellent informational videos, for patients for different conditions, just how to access healthcare, how to navigate the service, and so on. So rather than watching junk TV in those waiting rooms, it's a great opportunity. You've got a captive audience. You could target people, with those videos which are already produced, which are already there.
Yeah, it's a really good idea. Thanks for that, Tibbs. Okay, so I'll pass back to you, John, and thanks very much to the panel for answering those questions.
Thanks, Juanita, and yeah, thank you, everybody. I must say that's been a great discussion, and I think I'm certainly better informed now about the work of Patient Safety Together, and I'm sure our audience are too. And I think, it just reminds you of the complexity of what we do, and I think the importance of all those perspectives and all those voices in bringing it all together. And I think as many people have made the point, and Tibbs just made it again, this is only one part, I think, of the puzzle, or one piece of the puzzle. So I think I would encourage people again to look at some of the other resources we mentioned at the beginning, including the prospectus, and there's lots of other courses that I think fit very well with the work that we've been talking about today. So the prospectus, I think, is the place to find all of that. Again, please tweet or follow us on social media. If you missed today's talk time, or if you know somebody who'd like to watch it back, they can pick that up on the YouTube channel at National QPS, and follow us on LinkedIn. We're back in 2 weeks' time with special guests, Hilda Campbell, Maureen Flynn, who's well known to us all, and Joriam Ramos. And they're going to talk about creating networks for patient safety. So perhaps another piece of the puzzle we'll be talking about in a few weeks' time. So we would really encourage you to join us for that same time on the 5th of March. And again, you will get a short survey link after you leave the webinar today. Please do, even if it's just a few lines, please just tell us what you liked about the session today and what we could do to improve future sessions. You can also just scan the QR code there, and that'll get you onto our mailing list. And I think that's probably it from us. And I want to just thank our panel again. It's been a real pleasure, and we'll see you all in 2 weeks' time. Thank you very much, and thanks, Juanita, and all the guys who help us in the background to put this together.